Galsulfase solution is used to treat a specific rare genetic problem called Maroteaux-Lamy syndrome, MLS. This medication helps to replace a certain natural substance that is missing in people with MLS. It can improve the ability to walk and climb stairs, but it does not fix the genetic problem and must be taken for life. This medication is administered slowly into a vein as directed by your doctor, usually over 4 hours once a week. The dosage is based on your weight, medical condition, and response to treatment. If you are using this medication at home, Galsulfase will be shipped to your home. A nurse will come to your home to give you the treatment and to monitor you afterward. Do not shake the medication. Galsulfase should be colorless or pale yellow. Before using, check this product visually for particles or discoloration. If either is present, do not use it. Discard any unused prepared medication. Do not save for later use. Learn how to store and discard medical supplies safely. Galsulfase may cause side effects while it is being given and for a short time after the infusion has stopped. Your doctor may decide to stop or slow down the medication infusion for a while if this happens. Tell your healthcare professional right away if you have any of these symptoms. Your doctor may direct you to take other medications to treat your reaction and before your next treatments to prevent these reactions from happening again. Use this medication regularly to get the most benefit from it. To help you remember, use it on the same day each week. Tell your doctor if your condition gets worse. If you experience ear pain, eye redness, itching, discharge, or stomach/abdominal pain, make sure to tell your doctor or pharmacist right away. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. However, it's still important to watch out for any serious side effects such as changes in vision or hearing, back pain, difficulty moving arms or legs, or signs of kidney problems. Although rare, if you notice any signs of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. In the US, you can call your doctor for advice about side effects or report them to the FDA. In Canada, you can call your doctor for advice or report side effects to Health Canada. Before starting Galsulfase solution, make sure to let your doctor or pharmacist know if you have any allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have heart or lung problems. And if you're planning to have surgery, make sure to let your doctor or dentist know about all the medications and products you're using. If you're pregnant, only use this medication if it's absolutely necessary, and discuss the risks and benefits with your doctor. And if you're breastfeeding, consult your doctor before using this medication. Drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Make sure to consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Galsulfase solution and has serious symptoms like passing out or trouble breathing, it's important to call for help right away. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. This medication should not be shared with anyone else. Make sure you take each dose of Galsulfase solution on time. If you forget a dose, talk to your doctor or pharmacist to figure out when to take the next one. Don't take extra to make up for the missed dose. After mixing, store the vial in the refrigerator. Protect from light and freezing. Consult the product instructions and your pharmacist for storage details. Discard any unused portion. Keep all medications away from children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. Consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.